to put the medallion around the neck of the orator, because it's a protocol. He has to do the oration with the medallion on. Nirmala, ওখানে Thank you, Tarun. Start your wish.
Good afternoon, all of you. Respected my beloved teacher and professor Dr. Ashish Basu, and my senior Dr. Nirmal Bole and Dr. Amitav Bhattacharya, distinguished guests, faculty members, seniors, and all dear colleagues and friends. Thanks, President Dr. Vijay Chaudhuri, and Secretary Anjan Das, and other all beloved dignitaries of the Medical College Student Associations, for giving me the opportunity to present today on most dynamic area of the most modern healthcare system of Profullo Bala Kiran Shoshi Nag Memorial Oration on Stem Cell. I, Dr. Tarun Kumar Sarkar, Department of Gynae Obstetrics, Eden Hospital, Medical College, Kolkata. My topic is today, innovating tomorrow's medicine and infertility care through stem cell therapy. Today I will discuss how the stem cells and stem cell therapy are transforming the modern medicine healthcare. Now I will begin by basic concept of stem cell and stem cell therapy and regeneration. Life begins with formation of zygote, a single cell created when sperm fertilizes egg in the fallopian tube. This zygote is ultimate stem cell, totipotent stem cell. Totipotent means it is ability to form an whole entire human body. That is 220 cell lines, all tissue of our body, brain, heart, lungs, CVS. So this is totipotent, and supporting tissue like umbilical cord and placenta. As the zygote divides, it 16 cells stays morula, and then it transforms to the blastocyst. The inner cell of the inner cell mass is pluripotent stem cells. What do you mean by pluripotent? Pluripotent stem cells meaning it also ability to form all tissue of the human body, brain, CVS, all human being to form, but not placenta. 3 germ layers, ectoderm, endoderm, and mesoderm. This zygote will billion of cells will form our human being. Now, stem cell. Stem cell has 2 properties: self renewal and differentiation. What do you mean by self-renewal? Self-renewal means they divide and maintain their populations. What do you mean differentiation? Differentiation meaning the cell differentiated to the specialized cell who need it in our body. Now, stem cell is immortal. What do stem cell is immortal? Because under normal circumstances, after each cell division, the end of telomere reduces in size until it reducible stage. Irreducible stage is initiated apoptosis. What do you mean by apoptosis? Apoptosis is programmed cell death. Other hand, the stem cell cultured in vitro cells divide continuously to amniotic membrane and fluid derived stem cells. These cells include amniotic epithelial cells, human amniotic mesenchymal stem cells, amniotic fluid stem cells. What is the mechanism of action? Low immunogenicity, anti-inflammatory, immunomodulatory, high regenerative potential. Clinically applicable is wound healing, particularly in diabetic ulcer, food ulcer, corneal ulcer, chemical injury repair, ocular surface reconstruction, and orthopedic bone regeneration, osteogenic differentiation, cartilage regeneration. Cardiac regeneration, reduce inflammation, cardiomyocyte repair, and fertility restoration, endometrial regeneration, intrauterine adhesion repair from the amniotic membrane, fluid-derived stem cells. Next, very good source of mesenchymal stem cell, dental pulp stem cells. Easily accessible with characteristic mesenchymal stem cell marker. Functionally, they contribute to tissue repair, differentiation, odontoblast-like cell, secretion of growth factors, and immunomodulatory effects. Clinically, DPSC are used in regenerative odontics for pulp regeneration, dentin repair, bone regeneration, periodontal repair, and neural tissue engineering, that is neural crest origin. Menstrual blood stem. Menstrual blood derived stem cells are easily accessible. Cell differentiation, gynecological disorder, musculoskeletal soft tissue injury, chronic liver diseases, peractrin is anti-inflammation immunoregulation, promote angiogenesis, tissue repair, and anti-fibrosis. Immunomodulation, it helps tissue repair, regulation of immunocell function, and improvement of the release of cytokines and signaling pathways. Versus umbilical cord blood, UCB. Umbilical cord stem cell just as bone marrow. Hall E. Broxmeyer said in 1983. UCB transplantation nucleate a cell with HLMS, that is the transplantation, which history of Hampton delivered by Ellen Glagman, that is 1918. He used in Harrow's Matthew, twin sister collected from blood in New York and introduced in the Matthews in Paris. First incidence of the UCB transplantation in the world. UCB, umbilical cord blood transfusion as alternative to adult blood transfusion in anemia. In various etiology in 1990 by Professor Dr. N. Bhattacharya by School of Tropical Medicine, Kolkata. 2050 in India, government set up the first cord blood bank in Calcutta. Umbilical cord blood is admixture of fetal and adult hemoglobin, high platelet, WC kind, several cytokines, and growth factors, as well as hypoantigenic nature, potential safe alternative to adult blood transfusion. In any case of disaster in the world, or UCB also raise CD34, or the hematopoietic stem cells, plays adjuvant immunopotentiated therapeutic effect. Now, goal from West, role of umbilical cord blood. It is my paper in international conference. And next, other side, paired-rich plasma in the management of vulvovaginal disorder, systemic review. This is the cosmetic and regenerative gynecology. The extensive role of stem cell therapy in future, regeneration cosmetic gynecology. There is a reduce of menopausal symptoms, tissue repair, reduce inflammation. Now, umbilical cord stem cells. There is a mesenchymal stem cells, very rich source of umbilical cord. Umbilical cord derived stem cells, rich, ethical, non-invasive source from the collection of Warden Medi. It has highly proliferative capacity, low immunogenicity, and strong immunomodulatory effects. It differentiated to the bone, cartilage, muscles, and neural cells. Clinically, extremely studied in orthopedics, neurology, wound healing, and reproductive medicine. In IVF practice, they show improving endometrial regeneration and implantation outcome.